At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. Socratic questioning is a mode of inquiry developed by one of history's most influential philosophers, Socrates. It's a technique that people use to clarify their thoughts and how they perceive things by having them question their beliefs, assumptions, preconceived notions, and ideas. Socratic questioning, or the Socratic method, involves asking numerous open-ended questions about a topic. Questions should be open-ended so that people answering can have the opportunity and hopefully get the encouragement needed to think deeply about their thoughts and beliefs. The Socratic method was not developed necessarily to find answers, but rather to better understand why they think the way they think. Doing so is a good way to discover nuances they might not have considered before, thus leading to better reasoning, decision-making, and problem-solving skills. In order to properly practice Socratic questioning, here are some principles to consider. Ask open-ended and non-judgmental questions. The open-ended and non-judgmental questions should only revolve around the person's own thoughts. Open-ended questions are framed in a supportive way, so you don't make the person feel attacked, confronted, or judged. Socratic questioning is an integral part of cognitive behavioral therapy because of its benefits. We already know that Socratic questioning can help people develop critical thinking skills. But here are other things that Socratic questioning can help with. It can help CBT patients develop the attitude needed to challenge their negative thoughts and beliefs. It can lead to development of coping strategies. And it can help individuals discover things about themselves and empower them. Now that you understand the importance of Socratic questioning in cognitive behavioral therapy, here's how it's applied. Firstly, identify negative thoughts. Ask questions like, "What are you thinking right now?" to help patients articulate their negative thoughts and beliefs. Examine evidence. Encourage patients to provide evidence supporting or refuting these thoughts to foster more nuanced perspectives. Ask, "Do you have evidence for or against these thoughts?" Explore alternatives. Guide patients to consider more balanced or positive viewpoints by asking, "Is there a more positive way to view the situation?" Encourage action. Help patients pursue thoughts by asking, "What steps could you take to follow this positive thought, or what do you expect from pursuing this?" These steps help patients challenge negativity and adopt healthier thinking patterns. In the previous section, we mentioned a few questions you could ask your patient as part of the Socratic method. In particular, cognitive behavioral therapy practices like decatastrophizing, combating intrusive thoughts, and showing self-compassion use Socratic questioning. Here are some examples of Socratic questions that you can ask when you are treating patients using cognitive behavioral therapy. How does this thought or belief affect your emotions? How does this thought or belief affect your behavior? What evidence supports this thought or belief? What is the best case scenario if this thought or belief were false? What is the likelihood of the worst case scenario? What are your values? What thoughts and beliefs align with your values? To learn more about Socratic questioning, explore our guides library, which you can find on our Carepatron website linked in the description below. Carepatron is a practice management software known for its comprehensive features. Signing up is free. Just click on the link in the description. If you enjoyed this video, don't forget to press the like and subscribe button for more content like this.